Welcome to the Deep Dive, where we take a stack of information and extract the most important nuggets of knowledge and insight, custom tailored for you. Today we're plunging into an incredibly important and, well, often overwhelming topic: addiction. Specifically, we'll be exploring the profound insights found in Ellen Van Vechten's book, On the Other Side of Chaos: Understanding the Addiction of a Loved One. Our mission today isn't just to tell you about addiction, but to really cut through the complexity. We want to provide you, the family member or friend navigating this challenging landscape, with a clearer, more empowering understanding. We'll uncover some surprising facts, maybe dispel common myths that might be holding you back, and equip you with knowledge to make informed decisions and truly find your own path to serenity, even amidst the chaos.
Exactly. It's a journey into understanding the science behind addiction, the very real effects of different substances, and crucially, actionable strategies for both supporting your loved one and, importantly, fostering your own well-being. This deep dive is really all about helping you reclaim control over what you can control.
Okay, let's unpack this right from the start because
Please.
it's a foundational shift in how we understand addiction. For far too long, many people saw it as like a moral failing or simply a string of bad choices. But the science, as clearly outlined in our source, paints a dramatically different picture. So why is addiction now, universally recognized as a chronic relapsing brain disease? What does that really mean?
Well, what's crucial here is that leading health organizations across the board, places like the National Institute on Drug Abuse, NIDA, National Institute on Alcohol Abuse and Alcoholism, NIAA,
Right.
the American Psychological Association, APA, even the Surgeon General, they all define addiction as a chronic relapsing brain disease. And it's classified as a brain disease because drugs don't just affect behavior, they fundamentally change the brain's structure and how it works. These aren't like minor temporary tweaks, they're measurable, lasting alterations.
That's a powerful distinction. And this is where it really gets fascinating. The brain's reward pathways. We're talking about dopamine, right?
Exactly. When a person first uses a drug, it can cause the brain to just flood with dopamine, maybe up to 10 times the amount it would naturally produce. That initial rush, that euphoric high, it's incredibly powerful and it positively reinforces continued use. Of course it does. But then the brain, well, it tries to protect itself or restore balance. It actually slows its natural dopamine production. This leads to something called desensitization and tolerance.
Ah, okay.
So the user needs more and more of the substance just to feel anything close to that initial high, constantly chasing it. It's a doomed attempt, as our source puts it.
Right. And what about the relentless cravings that follow? Are those also just the brain at work?
Absolutely. And this raises an important point. The brain starts releasing dopamine in anticipation of the drug, not just during its use. This creates incredibly strong cravings that are just agonizingly difficult to control.
Like Pavlov's dogs.
Exactly like Pavlov's experiments. It's basic biology. Our source uses a great analogy. The brain has a natural on and off switch for desires, like hunger, right? But with psychoactive drugs, that off switch for desire gets completely stuck in the on position. This isn't a lack of willpower, it's a biological response, a literal rewiring.
I can imagine some listeners still thinking, but isn't there some choice involved? How does the disease model really counter that lingering idea?
Well, the argument that addiction is purely a choice simply doesn't hold up when you look at the physical symptoms,
Yeah.
tolerance and withdrawal, or the measurable brain changes we just discussed. Consider something like lung cancer linked to smoking.
Okay.
The behavior of smoking contributes, obviously, but the cancer itself is a disease requiring medical treatment. Addiction has behavioral components, yes, but at its core, it is a disease process. It impacts choice by severely impairing the brain circuits involved in reward, motivation, memory, and crucially, self-control.
So when it comes to diagnosis then, the term addiction isn't even used in the DSM-5 for neutrality, you said. What does that mean for someone seeking help or understanding a diagnosis?
That's a really crucial point for families. The diagnostic manual, the DSM-5, uses the more clinical term substance use disorders, or SEDs, and it also includes gambling disorders now. These are categorized as mild, moderate, or severe. There are 11 specific symptoms that fall into 4 categories: impaired control, social impairment, risky use, and pharmacological criteria. The number of symptoms present determines the severity level.
Okay.
It's important to know that the term addiction is generally used synonymously to refer to a severe SUD. This clinical framework helps professionals understand and treat without the moral judgment often associated with the older term addiction.
And gambling is truly in the same category as SUDs now. That feels like a significant shift.
It is. Problem gambling is officially recognized as an addictive disorder in the DSM-5 because it mimics the neurological and behavioral patterns of substance use disorders so closely. It even presents with similar withdrawal symptoms to alcohol, things like restlessness, irritability, abdominal pain, headaches, cold sweats, diarrhea, insomnia. It's a
Right.
powerful testament to how deeply the brain's reward system can be hijacked by, well, non-substance behaviors, too.
Finally, let's talk about something we truly have uh, utterly no control over,
Yeah.
as the source says, genetics. How significant is the role of heredity in all of this?
The role of genetics is profound, yeah, and it's something families often grapple with. NATO reports that genetics can account for as much as 50% of the risk for developing an addictive disease.
Half.
Yeah.
That's huge.
It is. The Surgeon General goes even further, stating maybe 40 to 70%. Specifically for alcohol use disorder, the DSM-5 indicates 40 to 60% of the risk is genetic, and that risk can be 3 to 4 times higher if you have a close relative with the disorder. It scales up too, with the closeness, the number, and the severity of affected family members. It's a powerful reminder that this isn't just about choice, it's about a biological predisposition.
Okay, now that we've firmly established why addiction is considered a disease, let's shift our focus to what the different substances and their unique impacts. Because it's not just about what a drug is called, it's about its class, how it enters the system, and what that means for a loved one witnessing its effects.
That's an absolutely vital distinction for families, yeah.
Yeah.
The speed at which a drug impacts the user varies widely by method of administration. Smoking or inhaling drugs is fastest, reaching the brain in near seconds, like 7 to 10 seconds. Incredibly fast. Intravenous injection is next, maybe 15 to 30 seconds. Snorting or subcutaneous intramuscular injection takes 3 to 5 minutes. Oral ingestion can take 20 to 30 minutes, and transdermal patches, like nicotine patches, can take days for effective absorption. And each method also carries its own specific risks, right? Like respiratory issues from smoking or the danger of HIV hepatitis C from IV injection. Our source then helps us categorize commonly abused psychoactive drugs into 4 main classes. This helps us understand their general effects and, how users might progress.
Okay, let's start with stimulants, often called the uppers. What are their defining characteristics, and what should loved ones particularly understand about them?
Stimulants fundamentally speed up central nervous system functions. Simple as that. This leads to increased energy, a rush of self-esteem and confidence, and often an enhanced sense of physical and mental performance. Think cocaine, methamphetamine, and synthetic cathinones like bath salts. But here's the catch for loved ones. Prolonged abuse can lead to terrifying symptoms like paranoia, hallucinations, and aggression. Really scary stuff. And when someone tries to stop, the withdrawal symptoms are typically the exact opposite of the high. Intense fatigue, overwhelming sleepiness, profound sadness, deep depression, plus an almost unbearable craving for more.
Speaking of stimulants, what about cocaine specifically? Our source flags it as particularly dangerous.
Yeah. The danger isn't just the drug itself, but the utter unknown of what's truly in it.
Okay, next, let's talk about depressants, often referred to as downers. These are the functional opposite of stimulants, slowing everything down.
Precisely. Depressants do exactly that. They slow down the central nervous system. They relax muscles, profoundly lessen anxiety, and induce sleep. Alcohol and opioids are key examples. Things like heroin, morphine, oxycodone, OxyContin, and fentanyl. The danger, and what loved ones need to be acutely aware of, is that they depress vital functions like respiration and heart rate.
Which leads to overdose risk.
Exactly. This is why overdose is such a significant risk, especially when these substances are combined with alcohol or other depressants. The effects compound.
And for opioids, what's crucial to understand about their withdrawal process? It sounds awful.
It is intensely unpleasant, yeah. Generally the opposite of intoxication. Severe anxiety, insomnia, diarrhea, high blood pressure, rapid pulse, coughing, and even really bad bone, muscle, and joint pain. It's physically excruciating. However, a critical piece of information for families is that opioid overdoses can often be reversed with an injection of naloxone, also known as Narcan.
That's so important to know.
It really is. This medication blocks the drug's effects and can restore breathing and heart rate, effectively pulling someone back from the brink. Fentanyl, in particular, is a grave concern. It's far, far stronger than heroin and presents a massive overdose risk due to its extreme potency and the unknown purity of what's sold on the street.
Our source also mentions benzodiazepines and GHB in this depressant category. What about those?
Right. Benzodiazepines like Xanax and Valium, they're intended for short-term use because physical dependence can occur surprisingly quickly. And withdrawal, it can lead to potentially fatal seizures if it's not medically monitored. Very dangerous to stop abruptly. GHB, a strong, fast-acting depressant, unfortunately gained a reputation as a club drug, and it has been tragically associated with sexual assaults due to its ability to lower inhibitions and inhibit memory, making it incredibly dangerous.
Then there are hallucinogens, which fundamentally alter perception, and inhalants. What should we know about these classes?
Hallucinogens like PCP can cause illusions, vivid delusions, and intense hallucinations, leading to a profound loss of connection with reality. This is incredibly disorienting and can result in dangerous accidents, even death from respiratory failure, or behaviors like jumping off a roof because the person genuinely believes they can fly or something similar.
Terrifying.
It is. Inhalants, found in many common household products like glue, aerosols, solvents, provide an initial stimulation followed by dizziness and lack of coordination. But the real danger here is their extreme toxicity. They are capable of causing sudden cardiac arrest, coma, or death even on the first use.
First use, wow.
Yes, and chronic use leads to significant, irreversible damage to the brain, heart, lungs, and liver. Really damaging substances.
Finally, let's talk about cannabis, or marijuana. It's a complex substance because our source notes it can act like a hallucinogen, a depressant, or even a stimulant sometimes. What are the key takeaways here, especially for young people and their families?
You're right, it's nuanced. While generally not associated with overdose death in its natural form, though it's important to note synthetic cannabinoids and high-potency edibles can be fatal. Marijuana undeniably impairs concentration, short-term memory, reaction time, and motor coordination.
Which impacts driving, for instance.
Yeah, absolutely. It doubles the risk of car accidents when driving under its influence. And again, those synthetic cannabinoids, often called spice or K2, are especially dangerous because they are so unpredictable and sometimes shockingly adulterated with things like rat poison.
There it is again. Why is early use, particularly for teenagers, so risky when it comes to cannabis?
This is a critical point for parents and loved ones to understand. Our source indicates that about 1 in 11 marijuana users overall will become dependent. But for those who start as teenagers, that risk jumps significantly to 1 in 6.
1 in 6.
Yes. This makes them 2 to 4 times more likely to develop an addiction within 2 years than adults who start later. This stark difference is because significant brain development, particularly in areas responsible for executive function, memory, learning, and inhibitory control, continues right up until the mid-20s.
So it disrupts development.
Exactly. Chronic marijuana use started in adolescence can literally disrupt this crucial development. It's also strongly associated with the development or worsening of anxiety and depression, and it can even advance the manifestation of schizophrenia symptoms in individuals who are genetically predisposed.
And the broader conversation around legalization seems to contribute to a perception, especially among young people, that marijuana isn't harmful.
Yeah, what's fascinating and concerning here is what our source calls the snowball effect. Studies from the Monitoring the Future survey suggest a direct correlation. As the perception of marijuana's harmfulness declines, often driven by media reports and legalization efforts, its use increases.
Makes sense.
It becomes a reinforcing cycle where decreased perceived risk leads to broadened legalization, which further reduces perceived harm, ultimately increasing use across the population. It's a complex societal challenge, really.
So, okay, you now have a solid grasp of the science behind addiction and the distinct effects of various substances. But what about your role as a loved one, living with or supporting someone in this situation? Our source calls addiction a family disease. What does that really mean for you?
It means that the crisis brought about by addiction is so profoundly disruptive that it impacts every single familial relationship. It ripples outwards. The critical first step for family members, and this is hard, is to truly accept that you are powerless over another person's use of drugs or gambling.
Powerless. That's a strong word.
It is. No amount of love, pleading, anger, bargaining, none of it can cure their disease. And, perhaps most importantly, attempting to control their addictive behaviors actually wreaks havoc on your own life. It steals your peace and well-being. This isn't about giving up, though. It's about shifting your focus.
But this acceptance isn't an excuse for inaction, right? It sounds like it could be misinterpreted as just throwing in the towel.
Absolutely not. That's a key distinction. Acceptance is the foundation for your healing, and it allows you to move forward with informed action. The source stresses repeatedly that treatment can and does work, even if it doesn't always succeed on the first try or the second. There's no real reason to wait for someone to be magically ready for treatment. Waiting can literally mean losing them forever. In fact, even involuntary treatment, like court-mandated care, can be successful just by providing that sober, structured environment where clearer thinking can begin to emerge.
That's a crucial point for families feeling helpless. So, if we accept our powerlessness over their use, how do we effectively set healthy boundaries when addiction is involved? This is often one of the hardest parts, I think.
Boundaries are indeed crucial, and they're really about protecting you. They are your personal limits and clear ground rules that you define and adapt for your own well-being. For example, welcoming a loved one back home could be conditional on maintaining abstinence with clear, stated expectations.
Like a contract, almost.
In a way, yeah. It's also strongly suggested that you maintain a sober environment in your home to avoid inadvertently activating cravings for them. That makes sense. And if you choose to offer financial support, which can be very, very tricky, it's always wise to pay expenses directly. Pay the rent to the landlord, pay the utility bill.
Not give cash.
Right, rather than giving cash directly to your loved one. If you're considering co-signing a loan, the source advises putting your name on the title for a car, for example, or basically expecting that you might have to pay the entirety of the rent for a lease. You have to be prepared for the worst-case financial scenario.
We've talked about brain changes, but what else causes addiction? It feels like there are so many contributing factors sometimes.
You're absolutely right. Causation is incredibly complex. It's almost never just one single thing. Our source highlights a mix of factors: genetic, physiological, developmental, environmental, and significantly experiential factors.
Experiential, like trauma.
Exactly. When we talk about experiential factors, there's a powerful and, frankly, disturbing link between trauma and substance use disorders. Studies consistently show that anywhere from, say, 42% to a staggering 95% of clients in treatment report a history of trauma. Some reports go as high as 90%.
90%. That's almost everyone.
It's incredibly high. Neglect, unresolved grief and loss, significant damage to self-esteem, these also play a major role. And it's also very common for individuals with SUDs to have co-occurring mental health disorders like depression, bipolar disorder, PTSD, affecting maybe 45% of those seeking treatment. This complex interplay is exactly why treatment must be so individualized.
Okay, so given all that complexity, when it comes to treatment itself, what should a loved one realistically expect? Is it a quick fix? A 30-day program and done?
It's vital to understand that treatment for addiction is very rarely a quick fix. It's often a long-term process. Because it's a chronic, relapsing disease, it typically requires multiple interventions and ongoing follow-up care, much like managing other chronic conditions like diabetes or asthma. Detoxification, for instance, is just the first step. It's stabilization, getting the substance out safely. It's not treatment itself. Time spent in a structured treatment environment enforces abstinence, sure, but more importantly, it allows the brain and body to begin to recover and promotes clearer thinking over time.
This brings us to a really impactful point, the individualized treatment plan. What does that typically look like, and why is it so tailored?
An individualized treatment plan is absolutely key because, as we just discussed, it addresses the person's unique underlying causes and any co-occurring disorders. These plans typically combine individual and group counseling, skill-building sessions to develop healthier coping mechanisms, community recovery support services, and often an introduction to 12-step principles. Medication-assisted treatment, or MAT, which blends specific medications with behavioral therapies, is also incredibly vital for many.
Like for opioid addiction?
Yes. MA can significantly ease withdrawal symptoms and cravings, particularly for opioid addiction. Medications like methadone, buprenorphine, and naltrexone have proven highly effective when used as part of a comprehensive plan.
And group counseling seems to be highlighted as especially integral to recovery. Why is that? What happens in groups?
Group counseling provides invaluable social reinforcement and peer support. It combats isolation. Dr. Irvin D. Yalom identified 11 powerful therapeutic factors in group therapy, things like the installation of hope.
Hope, yeah.
Seeing someone further along in recovery share their story is powerful. There's universality, that realization you're not alone in your struggles, huge. Then there's imparting information, learning from others. Altruism, the benefit you get from helping someone else, and even something called the corrective recapitalization of the primary family group.
That sounds complicated.
It's a bit of a mouthful, but it essentially means individuals can re-experience and work through challenging family dynamics within the safe, supportive setting of the group. It can be incredibly healing.
The source also stresses the importance of individualized care for specific populations, recognizing that one size definitely doesn't fit all.
Absolutely. The source says culture is the lens through which reality is interpreted, so culturally competent care is essential. This includes things like trauma-informed care for those with trauma histories, creating environments that are physically and emotionally safe. Women, for example, may metabolize alcohol differently, can progress faster in addiction, and often face more stigma, so they benefit from supportive, strengths-based approaches. There are also specific considerations for pregnant women thinking about fetal alcohol syndrome and neonatal abstinence syndrome, for veterans often dealing with co-occurring PTSD, for adolescents, given their unique developmental stage, benefiting from motivational interviewing and strong family involvement, the LGBTQ community, who may face specific identity issues and discrimination, and older adults, too, who might experience isolation, hidden disease, and complex medication interactions. Recognizing these nuances is just vital for effective treatment.
Okay, so if you're a loved one trying to navigate all this and find treatment for someone, where do you even begin? It can feel like a massive labyrinth.
It can certainly feel that way, yeah. A good initial starting point for screening and referrals is often the person's primary care provider, their regular doctor. Consulting experts specifically in the addiction field and utilizing national resources like the SAMHSA, that's the Substance Abuse and Mental Health Services Administration, Behavioral Health Treatment Locator online are also highly recommended. The first real step in the process is usually a thorough clinical assessment that provides a diagnosis and recommendations for the appropriate level of care needed.
And once you have some options, how do you evaluate the many different treatment programs out there? What should you be looking for or looking out for?
That raises a truly important question, and you should conduct a diligent investigation. Don't just pick the first or fanciest looking option. Compare the program services offered, the costs, their underlying philosophy of care, and crucially, ask how they measure success. Be cautious of programs that only report completion rates. That doesn't tell you much.
Right. You want to know about long-term recovery.
Exactly. You're far more interested in sustained recovery rates. Inquire about staff credentials, medical oversight, and the qualifications of any peer coaches or mentors. Ideally, those peers should have lived independently and sustained their own recovery for a significant period. The law generally requires insurance coverage for substance use disorders on par with other medical conditions, but navigating that pre-certification, ongoing authorization, that's key. They'll need to stay on top of it.
Good tip.
And always don't hesitate to do some online research. Look for local news reports or reviews about the program, see what others are saying.
What about when a loved one resists entering treatment? Which, let's be honest, is so often the case. How does our source suggest we approach that difficult conversation?
Yeah, it's a painful but very common scenario for families. Lydia suggests that for adolescents, it's important to reassure them they will be safe and cared for, that it's not a punishment. For adults, the emphasis should be on highlighting that seeking help takes immense courage, acknowledging that, and framing it that treatment can be managed and integrated into life. The goal is to offer supportive partnership in their effort rather than demanding or shaming them into it.
Okay, now let's address one of the most difficult realities for families,
Yeah.
relapse. The source repeatedly calls addiction a chronic, relapsing disease. What does that mean for our expectations?
That's correct, and it's a reality families really must prepare for emotionally. Studies indicate that 40 to 60% of clients relapse within the first 6 months to a year after treatment. It is. And the risk of relapse doesn't even fall below the general population's baseline risk until after maybe 5 to 7 years in sustained remission. However, and this is vital to understand, a relapse doesn't mean treatment failed.
Okay, that's important.
It simply means adjustments are needed, similar to a flare-up in any other chronic disease like asthma or hypertension. You adjust the treatment plan. Craving is a foremost predictor of relapse, often activated by those classic triggers, people, places, and things associated with prior use. And another major factor is something called post-acute withdrawal symptoms, or PAWS.
Pause.
Yes, these aren't just minor discomforts. They can be insidious, lasting for months or even years after acute withdrawal is over. They can trigger things like sleep problems, memory impairment, significant mood swings, all of which can strongly activate cravings and really challenge recovery. This is truly a marathon, not a sprint, for everyone involved.
So after all this, taking all this in, what does this all mean for you, the family member, in your own recovery journey? Because this is absolutely a shared experience.
It is absolutely a shared experience, and your recovery is just as vital. The first step is truly deeply accepting your powerlessness over another's use, and recognizing that your own life has likely become unmanageable because of the chaos of addiction. The profound shift is to control your actions, your responses, not theirs.
Focus inward.
Exactly. This is where resources like Family Fellowship's Al-Anon, Families Anonymous, FA, Nornon, Gamanon become invaluable. These are anonymous, generally non-religious groups where members share their experiences, strength, and hope. They support each other. And they're distinct from the recovery fellowships like AA or NA, which are for the person with the addiction themselves. Finding a group whose shared experiences align with yours can be incredibly helpful for your own peace and understanding. You realize you're not alone.
And for managing those immediate crises or just fostering your own personal strength when everything feels completely overwhelming, what can you do then?
In a crisis moment, the first thing is just take a moment to breathe. Seriously. Then prioritize basic self-care. Consistent sleep, good nutrition, some form of exercise if possible. Then maybe engage in small, solvable tasks. Clean a drawer. Organize something small, just to gain a sense of control and mastery over something, anything in your day. It helps. For the long haul, building your own personal recovery plan based on SAMage's principles is vital. That means improving your own health, strengthening your relationships, finding purpose, and actively engaging in your community.
This sounds a lot like fostering resilience, which is so key when dealing with long-term challenges like this.
Resilience is indeed a key attribute, and the good news is it can be learned and practiced. It's not just something you have or don't have. It involves cultivating positivity, maintaining hope even when things are bleak, keeping perspective, actively practicing gratitude, believing in yourself, focusing on problem solving within your control, and building a community of positive peer support for yourself. Mindfulness and meditation are also really powerful tools here, helping you focus on the present moment, letting go of those consuming worries about the past or future.
Just being present.
Exactly. Losing yourself in creative arts, building something with your hands, gardening, or even simple breathing meditation can restore a sense of peace and tranquility, even if just for a little while. Ultimately, there is no single route to wellness. Your personal recovery program should be chosen based on your needs, your strengths, and your interests. It's about finding what works for you.
We've journeyed through the intricate science of addiction, explore the diverse impacts of different substances, and, most importantly, discuss pathways to recovery for both those struggling and for you, the loved one.
You now have, hopefully, a deeper understanding of this complex disease, from the brain's hijacked reward pathways to the crucial role of family support and your own role within that. You understand that addiction is not a choice, fundamentally, and that informed action on your part, balanced with acceptance of what you cannot control, is truly key.
So what does this all mean? At the end of the day, it means that even when our loved ones face setbacks, or when circumstances leave you feeling like you have, as the book says, no cards to play, you now possess the knowledge, and hopefully the developing inner strength to respond deliberately, protect your boundaries, and pursue your own path to peace and serenity. Your journey through another's addiction can, surprisingly, become a profound catalyst for your own growth and well-being.